Broken promises and less positions causes increased stress and increased harms and results in poor retention.
Extremely shocked and disappointed to hear today that we are not going to get the promised additional staff. We have 9 staff that are supposed to be rostered in our acute unit, and instead of having 9, we had 2 staff. We can't close beds, we can't send people away. We're stuck with 2 staff running an entire ward.
Without the additional staffing that was promised in the last EBA, a system that's already under pressure will continue to operate in crisis, which isn't good for the staff already working there or the people that it's trying to service.
Without additional funding, we don't have enough staff to run a 24-hour access team despite the need.
We are overworked, exhausted, and our workplaces continue to be unsafe.
Staff will be left in unsafe environments, leading to physical harm, mental harm, and lifelong injuries.
The mental health system is under so much strain and pressure at the moment. Both service users and staff are reporting feeling under-resourced, under constant pressure, and a lack of supports. We really need these new positions to actually start implementing some of the reforms and improvements that were promised that we desperately need.
The public mental health service has been starved for years. I'm not sure how government expects the current workforce to meet the needs of the population and provide an adequate care when its staffing profiles just simply don't add up. The increased use in locums signifies the dire situation that the system's in, that it can't attract staff and it can't retain staff. I'm not sure how the system's supposed to mend when it's not being funded accordingly.
Without these positions, we can't deliver on the care that we really want to deliver. The Royal Commission recommendations go out the window.
Reneging on this deal will mean that my consumers won't get the specialist interventions that they need.
Reneging on this deal means that our public mental health service will be unable to meet the needs of the most vulnerable in our community.
Reneging on this deal means consumers will not be getting the specialist care that they need, and it makes my workplace in the community unsafe with poor staffing levels.
My concerns if the Victorian government reneges on its agreement is that we will not be able to deliver on the recent Victorian Commission of Inquiry recommendations and will not be able to transform the mental health service system as it is needed.
Having the government renege on this deal is really poor form and again going to make our job incredibly unsafe. They seriously need to think about what they're doing. It's just not on.
It's great meeting you all in August. Thank you for your time. But what we really need is the staff that you promised.